Welcome to Lesson 6 of the Medicare Masterclass. In this lesson, we are going to talk about financial help. Most people think of Medicaid, and when they think of financial help, and although that is a very crucial part of this lesson, there are a large variety of ways and methods to get help with your medical and prescription costs. So if you don't qualify for Medicaid, but still need help, this lesson is for you. So stay tuned. We're going to go over all of those options, and you'll be able to see what is available to you. So what we're going to cover in this lesson is first, Medicaid, of course. Then we're going to talk about Medicare savings programs, which is programs that you qualify for to help pick up some of your Medicare costs. Then we're going to talk about the extra help, low-income subsidy provided through Social Security, state pharmaceutical assistance programs, and other services. So already, on top of Medicaid, we've got 4 other ways that we can help save your costs. So let's go and dive in. So why is this important? Who doesn't love to save money? If you can pay less than what you need to, why not? So we're here to educate you about these programs so you know what's available to you and if you may qualify, because we want you to save money. So Medicaid, most are familiar with. It is a federal health insurance program administered by the state. And benefits will vary from state to state, but they have mandatory benefits they must cover at minimum. Anyone at, any age, can qualify for Medicaid, but it is based on your income and resource limits. So Medicaid will act secondary to most insurance, including Medicare. So whatever your insurance company doesn't cover, what you're responsible for essentially, including in Medicare, Medicaid can help pick up that difference. So a Medicare savings program, there's a variety of them, and essentially they're there if you do not qualify for Medicaid. They can work with Medicaid, but these are specifically designed to help pay some or all of the Medicare premiums, deductibles, coinsurance, and copays. So we're going to go through each one of those. I do warn you, there's a lot of acronyms in Medicare. I don't know why. So we'll tell you what those are too. So the first program is QMB Plus, which stands for Qualified Medicare Beneficiary Plus. When you have this program, you have full Medicaid benefits on top of the program paying your Part A and B premiums, your deductibles, coinsurance, and copays. You hardly have to pay anything on this program, and it's really nice for those who qualify for it. The next one is just QMB, Qualified Medicare Beneficiary. So the difference between this one and the Plus program is it's still paying your Part A and B premiums, your deductibles, coinsurance, and copays, but you do not have full Medicaid benefits on top of that. Medicaid can give you extra benefits like transportation and dental and a care coordinator. And so you don't have those benefits, but you still have your Medicare expenses covered mostly. The next one is SLMB Plus, or I've been told it's called SLMB. It's a little more fun to say, which is Specified Low-Income Medicare Beneficiary Plus. And that's a mouthful for you. What happens here is you do have full Medicaid benefits, but you are only having your Part B premium paid for. So not quite everything, but hey, that's still money saved in your pocket each month. And then, of course, you have regular SLMB, Specified Low-Income Beneficiary, where you are just getting your Part B premium paid without any Medicaid benefits. So the next savings program is very similar to the SLMB. It's QI, Qualifying Individual, where it is just paying your Part B premium, but the difference is because it has different income limits, you must reapply each year. But it'll still cover your Part B premium and save you that money. This one is QWDI. I don't know a fun way to say that one, but I'll let you use your imaginations. But this one stands for Qualifying Disabled Working Individual. So, as we've mentioned in previous lessons, you are entitled to Part A premium free if you've worked 10 years and you've paid your Medicare taxes for those 10 years. So this savings program applies to those who maybe did not work those 10 years or who have legal status under a green card and were disabled and under 65. So they were disabled, they received Medicare after the 24 months, but they were not entitled to premium-free Part A. So this program helps to pay that premium for those individuals who qualified for Medicare early and didn't, basically have to have a Part A premium. So, and the last Medicare savings program is full benefit dual eligible. Full Medicaid, full benefit dual eligible, which is very similar, pretty much the same thing as QMB Plus. You have full Medicaid benefits. It's paying your Part A and B premiums, deductibles, coinsurance, and copays. But the reason we put this on here is it's separate from Medicare savings programs as you qualify through a different mechanism. So it's not necessarily a Medicare savings program, but it's on here because it works like one. But you qualify for it differently. All right, now we're going to talk about the Extra Help Low Income Subsidy. This is a federal program through Social Security that helps pay for some or most of your prescription drug costs. If you qualify for a Medicare savings program and Medicaid, you automatically qualify for the Extra Help Low Income Subsidy. But if you don't qualify for Medicaid or a Medicare savings program, you may still qualify for the Extra Help Low Income Subsidy. So I always say, it's worth a try to try it out. Go apply, see if you qualify for it. If you do, great. If not, that's okay. At least you tried. You can try applying again later. So these have different stages of how your drugs are picked up, and it's based on how much it's paying. So this first Extra Help level is 25%, where basically you pay 75% of your Part D premium. You have an $83 drug deductible as opposed to the maximum limit, which is set by Medicare, and you pay 15% of the cost of each drug. So with your Part D premium, with a standalone prescription drug plan, the full premium of that plan is that. With an Advantage plan, it actually is a combined premium of medical and drug benefits. So you can have your premiums lowered on both types of plans if you have the Extra Help Low Income Subsidy. And so you might pay a lower premium. Kind of nice. Again, we're saving you money. The 50% level of coverage pays 50% of your Part D premium, and you still have the $83 drug deductible, 15% of the cost of each drug. The same thing applies to 75% and 100%, except you're paying less and less of your drug premium. The last one is called Full Extra Help. What happens here is you have a $0 drug premium, no deductible, and small copays and coinsurance. If you remember back to lesson 4 when we were talking about prescription drug costs and the stages of your drug coverage, if you remember the catastrophic stage, the stage after the donut hole, essentially when you have full extra help, you are basically in the catastrophic stage all year long, which means you have small copays and small coinsurances that are very, very, very affordable. And it's nice. So, hey, apply. See if you qualify for this because it can help save you a lot of money on your prescriptions. And also the nice thing about the low income subsidy is if you qualify for any level and you happen to have a Part D late enrollment penalty, then that penalty is waived. So after what you pay and what Medicare pays reaches the yearly limits, you'll pay small copays and coinsurance for the remainder of the year. So it's still applying to the stages of your drug coverage in Medicare. So you still have those limits, but if you hit them, then if you hit those limits, then you'll move on to the next stage unless you have full extra help, which basically moves you to the last stage automatically. So state pharmaceutical assistance programs are programs that states have that help pay for drug plan premiums or drug costs, but they have specific requirements. A lot of times they could be based on a certain condition. For example, prescriptions related to HIV or AIDS. There may be a program available to that. So you can find your state's pharmaceutical assistance programs on Medicare.gov, or you can call your local Department of Health and Welfare, and they should be able to have information on what plans are available to you there. The final resources are, there are a lot of places that are just standalone companies that can help really save some costs on your prescriptions. So local clinics depending on where you live, there might be some clinics that will actually slide your rates based on your income. Terry Riley is one that's based in Idaho that I personally have used, and they're fantastic. They will slide our rates based on for our dental coverage, as we've been building a business, and our income isn't quite where it needed to be at the time. They helped us have cheaper dental coverage, but they will do it for medical and even prescription coverage. So check around your area to see if there are similar local clinics that can do that. GoodRx is one of my favorite things that I teach my clients about. It's either a website, you can get a little card, or you can use the GoodRx app on your phone. That's, in my opinion, the most preferable way. It's a coupon service that helps you find low prices for most prescriptions in your area. And depending on the pharmacy, you can pay cheaper at certain pharmacies over others. So this won't work for all drugs while you're on Medicare, but this can help save a lot of money on certain prescriptions. Sometimes this is cheaper than what insurance will offer. So it's good to check your prescriptions on that and see if, hey, you can save some money. Universal Prescription is a mail order service that sources prescriptions from international pharmacies. I personally have met the owner of Universal Prescription, and they're a fantastic company. They have an extreme strict vetting process that they use when they select international pharmacies, and they can get prescriptions cheaper than a normal pharmacy here in the United States. Now, it won't always be cheaper than insurance, but it can be, and they can ship your prescriptions to you via mail order, and they're a great service as well. RX Access is a program that searches for deals and discounts for your prescriptions. So you call them up and they help find the programs for you, essentially. Not too bad. Prescription Hope is an awesome service that if you qualify for it, you'll pay a flat $50 for any drug, even if your prescription ends up being $10,000 a month. So you do have to qualify for it, but their limits are listed on their website, and check it out. It's really helpful for those really expensive drugs that can put you in the donut hole quickly. Partnership for Prescription Assistance is a free service that will help you find prescription assistance programs you might be eligible for. So also similar to RX Access, they kind of do the work for you. And then, of course, a lot of manufacturers such as Pfizer and other companies will have discount programs on some of their prescriptions. Sometimes you have to qualify for them, but check with them. See if you can get those prescriptions for cheaper. Because the ultimate goal with a lot of these is to keep you out of the donut hole as long as possible and save you money. That's what we want. So when in doubt, the last thing you could do is Google it. Go online. There are countless resources, and that's honestly where I found a bunch of those ones on the previous slide. So you can find help to pay for almost anything you may need. Just know what to search for and go for it. So this concludes lesson 6 on financial help. The next lesson is our last lesson. We hope you have learned a lot about how Medicare works and what you can expect. And our next lesson is focused on exactly what you need to do and what your role is in taking responsibility for your Medicare. So thanks for watching lesson 6, and we will see you in our final lesson. Have a good one.